देखिए, लुधियाना शहर में सबसे बड़ा जो नॉर्थ इंडिया में इस समय हम कह सकते हैं कि बहुत प्राइवेट हॉस्पिटल जो है किसी एसोसिएशन संस्था की तरफ से चलाया जा रहा है, तो वो डीएमसी मेडिकल कॉलेज है। तो समय समय पर ये प्रोग्राम कॉन्फ्रेंस वगैरह ऑर्गेनाइज करते रहते हैं। तो आज भी जहाँ पर इन्होंने क्लब निर्वाणा जो होटल भी है, उसमें आज एक प्रोग्राम रखा है, कॉन्फ्रेंस रखे, जहाँ पर काफ़ी जो अलग अलग यूनिवर्सिटी के स्टूडेंट्स हैं वो पार्टिसिपेट कर रहे हैं। वो आज चर्चा करेंगे कि आज समाज में जो हमारे प्रॉब्लम आ रही हैं, मेंटल प्रॉब्लम आ रही हैं, उसके बारे डिस्कस करेंगे। तो चलिए हम देखते हैं चलकर जहाँ पर कॉन्फ्रेंस हो रही है क्या बातचीत कर रहे हैं।
Phenomenology or psychophysiology very quickly, which actually may not be existing. So certain tips to overcome is that you have to have a focused interview and following a structured format, knowing what to ask next, observe a senior or faculty member while interviewing. You have to have a good hold over the area by knowing how to elicit depressive symptoms, cognitive symptoms, psychotic symptoms, what questions are asked to elicit such symptoms, and understanding the diagnostic criteria-based approach from very deep criteria. Then by understanding the criteria, what I have to ask for this to fulfill this criteria, right? And also you can write the verbatim of the patient or record the verbatim of the patient and analyzing it if any questions have been missed out. Like for example, for example, you have to ask, like, does it become very much too much of your thoughts? Can you know more about it? What idea? Do you think that these thoughts are your own idea? So these are some of the questions how you can proceed. So another thing that always after you are thinking that the interview is over, I have already labeled this psychology. Again, you have to ask the question to yourself that have I asked enough to level the psychology? And don't be shy to interview the patient again or ask the same question again. So do not try to elicit all the psychology at this stage because it can lead to your own mental fatigue as well as the patient may lose some important details. Also, always take the help of the senior study and faculty member. You need to acknowledge your low fault and mistakes because we learn by our mistakes. So another area is that eliciting pre-orbit personality. Many times I see that the trainees fail to understand the concept of pre-orbit personality and they just write well-adjusted personality. So because we need to understand that it helps in understanding the behavior of the patient, it helps to understand how the patient has coped up previously, the strengths and weakness, and it also helps in management of the patient. So issues encountered is that not giving proper time and importance to assess the pre-orbit personality, maybe because of unable to access it properly, not knowing the format how to assess it, and lack of knowledge. So we have to follow a structured format, maybe for the mail cross, or you can use brief IPD screen, which is easily available, and take time to access it later if not at the first visit. So this is the format of mail cross which you may be knowing it. So it is very important to elicit and you need to memorize it, you need to ask it. If not at the first visit, at the subsequent visit to ascertain that whether the patient is already well adjusted or has some personality traits. Next, the problems which you face in the mental state examination is that, which are usually reported that we know the definition but how to ask, we know the definition of range reactivity but how to ask them, how to elicit them. So jumping from one segment to another without understanding how to proceed and unable to tailor-make the MSc as per the patient condition, you cannot follow the same sequence for every patient because you have to tailor-make as per the needs of the patient, as per the situation. And we may miss the important point to elicit or document in the thought content, position and perception. And lastly, that many times I see that they mention the past is in the MSc, but MSc is for the present condition on that particular day and time. So these things has to be kept into mind, which are usually missed out or put it wrongly. So now coming to what in special sections and settings, we also face different problems and challenges. First is the substance abuse, because many patients have comorbid substance use, or primary patient is coming for treatment of substance use. The difficulty which is faced is that difficulty in taking a proper and realistic history, types of substances being used by the patient. So you need to know first what are the prevalent substances available in the subsequent area or the community, various names given to the same substance like white, brown, saman, and names also varies from place to place from where the patient comes, and difficulty in ascertaining the quality of the substances, and also problems in establishing dependence. And also, very questions comes to that trainee becomes anxious that what to do when the patient undermines the problem and skillfully denies that I am not taking this substance, but evidence is there to suggest the opposite. And what to do if the patient gets irritated when you ask details about the substance uses. So there are these things comes when you do again and again take the history from your experience, but tips are there that you need to learn the local names of the substances being used in the community, asking the patients about all the types of the substances, even if he has come for the alcohol related issues. So you have to ask whether all these substances, you have to give a menu of substances, whether he has used it before or not, and whether he is established before in the past or independence criteria. Do not rush to determine the personality of the patient. Don't just think that anybody who is taking any type of substance has antisocial personality. It can be because of any other medical issues or psychosocial issues he has. So, for example, the agitation can be secondary to immediate withdrawal of antidepressant versus agitated depression, or tremors, restlessness secondary to antipsychotic agitation, or it can be due to exacerbation of psychosis. So, for this, you have to do a careful history taking, excluding differential one by one, having a good knowledge about psychotropics, common side effects,
including all the residents, the PG students who are sitting here as frontline healthcare workers. I say this because today most of the students who are attending with us, they belong to the intake batch of 2020 who are going to appear very soon for their PG, the postgraduate MD final exams. What we have been referring to them as the COVID batch.